Good morning, everyone. I hope you're having a great day. I am off to the OR shortly, but today I thought I'd talk about something that came up in the office a lot yesterday and something that patients ask me a lot about, and that is about canthal suspension. So what is canthal suspension? Canthal suspension is a general term where the canthus, the outer corner of the eye where the upper and lower lid meet, is secured to help support the lid during aesthetic surgery or sometimes for corrective surgery also. It's a general term that encompasses certain procedures. One procedure is a canthoplasty, one procedure is a canthopexy. What are the differences between the two? Well, a canthopexy is when the eyelid muscle or tendon is secured by folding it on itself, what we call a plication suture. It's not a very powerful procedure. It gives the lid a degree of support, but it's less disruptive of the anatomy of the canthus and changes the canthal position slightly, if at all. On the other hand, a canthoplasty is a procedure where the tendon of the lower eyelid or the substance of the lower eyelid is modified. It's cut or shortened and then re-secured to support the lid. When that's done, there's more disarticulation or taking apart of the canthus and its anatomy. And that means that while it's a more powerful procedure, there's a higher incidence of changing the appearance of the canthus or the height of the canthus. So why is this important? Well, let's say someone comes and sees me for a complication of surgery where the lower lid has been pulled down, what's called eyelid retraction. In those cases, you need a more powerful procedure to support and sometimes realign the canthus. And in those instances, I prefer a canthoplasty. Again, where the eyelid tendon or eyelid substance is modified and re-secured to give support to the lid. Now, this can be performed by a cut in the outer corner of the eyes that usually heals beautifully. It can also be done in a fashion where the incision's in the upper eyelid crease. In the upper eyelid crease, it's called a closed canthoplasty because the corner is not opened. And when the incision's made in the corner, it's called an open canthoplasty. And there's many variations of these procedures. To secure the lid, it can be secured to the lining of the bone called periosteum, or sometimes a little hole is drilled in the bone to secure it. That's called a drill hole canthoplasty. So the main point is that canthoplasty is a more powerful procedure, a more stable procedure, but it could change the position of the canthus and change the slant of the lid more. Whereas a canthopexy, which can also be performed in an open or closed fashion, is less powerful, so there's less change in appearance, but also less effect. Okay, so with that in mind, let's ask ourselves, why do these procedures, why are they important? Well, when you do lower lid blepharoplasty and skin is excised from the lid, typically you have to support the lid to prevent it from coming down. Now, there's this misconception that if you perform a canthoplasty or pexy, the lid position cannot change. That is not true. Eyelid shape being pulled down, what's called retraction, is more related to what's done to the skin, the muscle, and the fat than what we do in the canthus to help prevent the problem. So if you're performing more aggressive surgery, more skin, muscle, and fat is removed, there's a higher chance of this happening, especially when skin and muscle is removed, and especially when surgery is done from the outside of the lid, what we call transcutaneous surgery. On the other hand, when surgery is done from inside the lid to access the fat, and from outside the lid to remove a little bit of skin and the muscle is undisturbed, the chance of retraction is much less. But in both instances, a canthal suspension can help prevent that change in eyelid position. However, to stress again, the change in position is more related to what's done to the eyelid anatomy, skin, muscle, and fat, than what we do to prevent it by suspending the canthus. When you suspend the canthus, it has to be tension-free, like a facelift incision is. If it's not tension-free on a facelift, then the incisions on the facelift can spread and other things can happen. The same thing in the canthus. If it's not tension-free, then there can be downward stretching and pulling on the lower lid, even if a canthal suspension is performed. Now, I'm asked by patients all the time, do I need a canthoplasty? Do I need a canthopexy? This really depends on the surgery being performed and it depends on what we're trying to accomplish. As a general rule in aesthetic surgery, the less you manipulate the canthus, the less problems you'll have. So you want to leave it as undisturbed as possible. However, if a canthal suspension is necessary to protect lid position, the integrity of the eyelids, and to protect the eye, then it must be performed. I think that basically covers what I'm trying to say. It's just a small overview of what canthal suspension is. I have so many questions from patients about this, and if something comes up that you're questioning and you want to learn more about it, just DM me and have a wonderful day.